our emergency general meeting. But before then, we had our last OGM, and we sent a communique to the minister and the mandate secretary, the permanent secretary health, the acting general DG of the HMB. We issued a communique to them stating about the issues we've been having on ground for some time now, about 13 of them. And the first one we wrote to them about was about the severe or chronic, let me use that word, chronic, lack of manpower among us. The hospitals in FCT, the 14 hospitals, including the primary health care and the rest. And we tried to dialogue with them, but unfortunately, we never heard from them. We gave them a 7-day ultimatum to do the needful so that we could find a way to solve this problem. They never reached out. And then on Thursday, we had our emergency general meeting to discuss about the modalities of the thing that was going to happen if they never listened. And so the Congress voted that we should go on a 7-day warning shutdown starting from this morning, 8 o'clock. And we're here to do the needful. Let me thank you for coming. Let me thank you for the solidarity. And let me thank you for making sure that even with the fact that the healthcare system in FCTA have been falling apart for some time now, we've always tried as much as possible to block the loopholes. But for how long are we going to continue to do that? When our members are falling sick, when our members are breaking down, when our members are taking antidepressants, when our members are using antihypertensive medications. So we thought we had to do the needful. And the needful will be to go on a 7-day warning strike, hoping that the powers that be will listen and do the needful. We are severely starved. In our 14 hospitals, we are severely starved. It happens that we even have some of us who are taking 3 to 4 calls every week. Some of us, or most of us, who are taking as much as 12, 13 calls a month. We have some of us who will do a CS, who will do as many as 7 to 8 CS in a day, and they're expected to still go and run their calls and work the following day. And the most alarming of all of these is that those people, even with the fact that we do this job for them, they are not paid, they are not promoted, they are not skipped, and we continue to try to do our job by saving lives, thinking that at a point in time, the powers that be at the other side will listen and do the needful. And they have still refused to listen, they have refused to employ, they have refused to pay, they have refused to promote, they have refused to skip, they have refused to convert our fellow colleagues who have passed their Part 2. They've refused to pay the 13-month hazard allowance arrears. We are getting demoralized now. We can't continue to work in this pattern. If we continue to work in this pattern, none of us is going to be alive anymore. So we have to do the needful. And the needful is what we're doing this morning for 7 days. Let me start by saying that for a long time, we haven't had employment in FCTA since 2011. We never, those that retired have not been replaced. Those that have left the country, the Japa syndrome, have not been replaced. Those that died have not been replaced. We keep doing, one doctor does the job of 5 to 6 doctors. A doctor will see up to 30 to 40 patients, and then he or she is going to go and do a call for another 2 days. A doctor is going to sleep in a call room that has no bed. that has rodent and reptiles. A doctor is going to work with cannula on his or her body, seeing a patient while he or she is sick. So we continue to have issues like this happening. And we have come to realize that we are becoming harmful to our patients, and we are becoming dangerous to ourselves. And we can't continue to work this way. If we love our patients so much, we have to stay away from them. We can't keep treating them when we are sick, mentally, psychologically, physically. We can't keep doing that. If the government is refusing to employ, then the best thing we can do is to sit at home. And they know that when we work, our job is to make sure that our patients are well catered for medically. So therefore, my fellow congressmen and women, why we're here is to make sure that the strike is upheld to the fullest maximum. Our doctors are not being paid. We have doctors have not been paid for like 1 year, 2 years, and are missed today. Some have not been paid for 7 months, 8 months. And each time we try to talk to them, they keep giving us these vain promises. Don't worry, we're going to pay you. Just keep working. They even mock us. People, I mean, are you not? It's not your calling. You are there to save lives. What do you need the money for? We're not asking them to increase our salaries. We're only saying, pay us the money that we have worked for. How do you owe somebody a hazard allowance of 13 months since 2021? And each time we go to meet them, they keep telling us the same story. It's not in the budget. Wait for the supplementary budget. For the past 5 years, we've been waiting. We've changed ministers, we've been waiting. We've changed mandate secretaries, we've been waiting. Then we have the newly employed doctors, the external residents, 4 months now. They've not been paid. We don't even know if they have files at all. But they started working. No files for them, no payment for them, no incentive for them, no nothing for them. And they are supposed to be proactive. How do you want a hungry doctor to take care of someone that is sick? A hungry doctor is a very dangerous doctor. It's going to kill people. So we can't allow that to fly. We can't keep having the system exploiting us. We can't allow that to happen. How does somebody pass an exam for the past 5 years as a consultant? You don't convert, then you keeping him as a medical officer, maybe as a senior medical officer, for 3 years, for 4 years, for 5 years. And then you are giving him or her a letter this year, and you are telling him that that letter is not going to go into effect until next year, January. What happens for the whole period of the 3 years and 4 years? That is a classical example of exploitation. How do you build up morale among doctors when you are owing them, when you don't promote them, when you don't convert them, when you don't skip them, but you want them to be proactive, doing the job they are even overdoing what they're supposed to do? So we are actually frowning against this. We can't continue to pretend to be sleeping. We are beginning to get damaged physically. And if we love our patients, then we have to stay away until they start to listen to us. And they should listen to our need, not to their own need. We can't tell them that we want more hands. You're telling us that you are buying ambulances for us. To carry who? The doctors? Corpses? So we have a lot of things to actually talk about. MRTF, the Medical Residency Training Fund. This is a national act. Am I right?
Yes.
And we're supposed to be paid every month for this. Every year. Even every month is even small. It should be every week, actually. Every year for this. And then we hear talks about doctors loving to go for training and retraining. That is why we are doctors. We go for training and retraining. If you don't go for training and retraining, then we can't do the kind of jobs we're doing. We can't have a doctor in a theater for 6 hours. Where's that picture of that fibroid we removed just last week? Is it here? Massive one. It took them 6 hours to do that surgery. The MD was there. The HOD of surgery was there. Reverend Sister was the lead consultant. Dr. Ibrahim was there. I was running around. 6 hours. That's flying from here to Heathrow. And then we hear things like we love to go for training and retraining. That is what makes us doctors. We need the training. We need the retraining. We need the researchers. If we don't do this, then we cannot be better doctors. We have heard stories that we never contacted the office, the office of the minister, that we just issued ultimatum. I want to show you that we have almost 30 of acknowledgements from the minister's office. These are all the acknowledgements from the minister's office. Meaning, on an average, we send him 2 letters every month. So it's either he's not reading them or somebody is not giving the letters to him. But it was so disheartening to hear that we never tried to reach out to him. We have met everyone that knows him, even within the same political landscape. We've spoken to them. We've told them to help us talk to the minister because we feel that the minister alone can solve our problems. And we want to try as much as possible that this is sorted out. Because we have issues with our working conditions. You go to a place like Abaji, for example, we don't know if they are now doctors or vet doctors. Because what they do now is why they are seeing patients, they are killing snakes at the same time. In the wards, in the consulting rooms, in the call rooms, we have begged and begged and begged and asked them to fumigate. And nothing has been done. We lost a colleague to a snake bite like 2 years ago. Yes. In Abaji. A nurse, right? Mm-hmm. And then we have some that had snake bites and we don't even have anti-venom. And we're saying that we need our working conditions to be better. You go to our call rooms. This is a staff. This is a doctor who, despite the fact that she had a fracture, she still came to work and a leg ulcer to see patients because we are short-staffed. And on this day, she told me she saw 35 patients in GOPD. And nobody cares if she's surviving or not. Nobody cares how she goes home. Nobody even cares if she walks or crawls. Just do the job. These are examination bed. Just tell me there is no bed bug in this one. This is how we're supposed to work and see people and be excited. This is accident and emergency. It's supposed to be sterile. How does this even look sterile to anyone right now? So, we are not here to fight anyone. We're only here to tell the employers that we can't continue to do this job when we don't have what we are supposed to have. And that's the thing. We have a lot of arrears they've not paid, and they should work on them. They should pay them. In fact, they should pay them immediately because this is a 7-day warning strike uninterrupted until they do all that we have sent that they should do. We're not going to call off the strike. It's going to be a 7-day warning strike uninterrupted. Every of the things we've requested that they do, every of them is a low-hanging fruit. So there is nothing like let's do some and let's leave some. Everything has to be done. And as the Congress has mandated, after the 7-day warning strike, we're going to reconvene again. If nothing is done, they will go on an indefinite. We can't continue to work in this manner. We need to do the needful. And to our patients, we are sorry. We are not doing this to spite you. We are doing this to protect you. We are doing this to protect you. When you have a doctor who is seeing you and is sleeping off, you should know that your life is not even safe. We need to be careful now. We are beginning to have a lot of unforced errors where a doctor does a lot of things because he or she is mentally fatigued. Fellow congressmen and women, that is why we're here today. We're here to make sure that we are compliant with the warning shutdown, and we have sent our communique to the minister's office
They don't open up.
Even though we're told that by this time it's not been opened yet. And that's the thing. We come to work by 7:30 in the morning. Some offices don't even open till 1 p.m. But they send circulars and memos that make our life very miserable. You go to Civil Service Commission, you don't even know if they're even there or not. You go to HMB, you don't even know if they're even there or not. But we're here all the time. And each time we're getting a lot of memos and circulars, making life even more miserable for we that are trying to make the system to even work. So I'm going to pause for now. I think I've done a summary. We have non-payment of our arrears from the upward review of our CONMES. We discussed about that. Then we have unexplained deductions from our monthly salaries. Aside the fact that they are delayed in payment, they are even deducted without explanation. Nobody even has an idea of why these deductions are taking place. You get your salary today, it's 50,000 short. You get it next month, it's 80,000 short. Nobody has an idea of why it's happening. So we need them to know that all of our demands must be met. It's all or none. All of our demands must be met. And the ones they cannot meet, they have to put it in writing. And us being there, we're going to sign with them that they're going to do it. We're not going to believe them orally anymore. We've been believing them for the past 1 year, 2 years. We're not going to believe them anymore. Thank you so much. God bless you.